Good day. So now I'll be demonstrating bed bath. So first, I'm going to review the patient's chart for limitation to prevent discomfort as well as injury. After that, I'm going to bring the materials that are needed to the bedside to conserve energy and time. After that, I'm going to perform hand hygiene and put on gloves. So let me just put on the gloves first. So after putting on the gloves, I'm going to identify the patient, explain the procedure, and assess the patient's ability to know how to assess the patient when bathing. So, good day, sir. My name is Karl, a student nurse from OLFU. May I know your full name and date of birth, please?
January M. Graduated in 2007.
Okay, so now, sir, I'll be giving you a bed bath to make you feel comfortable after the procedure. Is that okay? May I have your consent?
Yeah.
Okay, so after that, we did that to ensure that the patient is the right patient receives the treatment or the intervention, and to alleviate the patient's anxiety and let them know what will happen. Okay, so after that, I'm going to provide privacy for the patient by closing the curtain and adjusting the uh, temperature of the room to help the patient not get cold during the procedure. Okay, so after that, I'm going to remove the patient's anti-embolism stockings. So since the patient doesn't have any anti-embolism stockings, which we already did that to assess before the bathing process. Next, after that procedure, I'm going to offer the patients a urinal or bedpan. So, sir, do you feel the urge to defecate or urinate?
No.
Okay, so for example, imagine that we provided the patient an urinal or bedpan. We're going to remove our gloves. So, after removing the gloves, after removing the gloves, I'm going to adjust the bed to appropriate height to prevent back and muscle strain. After that, I'm going to put on gloves again. So after putting on gloves, so imagine I put on my gloves now. I'm going to provide a bath blanket to the patient after loosening all of the top cover of the patient. So we have to loosen it to prevent tugging and tearing on the linens as well as making the patient discomfort. So, sir, could you hold on to your bath blanket, please? Could you hold on to this, sir? Okay, so now I'm going to remove the top blanket of the patient while preventing them from being exposed and making them feel warm. So after taking this off, we're going to dispose it on a hamper, and then after that, we're going to remove the patient's gown. So first, we're going to remove all of the patient's gown. So after we remove the patient's gown, we're going to provide a towel on the patient's chest. Next, we're going to get the limited and folded without any edge, and we're going to clean the patient's face, eyes, ears, as well as the patient's neck without any soap to prevent irritation. So, now that we've cleaned the patient's face, we're going to wash the washcloth, and then moving on, we're going to clean the patient's arm by exposing it. After exposing the patient's arm, we're going to provide a blanket under the arm to dry it and keep the bed from getting wet. So, we're going to clean the patient's arm, hand, as well as the armpit of the patient by lifting their hand. Next, we're going to dry it. After drying it, we're going to soak the patient's hand on the basin while washing, rinsing, and also drying the patient's hand. After that, we're going to move on to the other side of the patient. So, we're going to get the towel underneath the other arm, place it on the next or other side of the arm. And then again, we're going to wash the mitten and then fold it. And wash the patient's arm, hand, as well as the armpit. And then dry it. After that, we're going to soak the patient's hand on the basin again. And rinse and dry it as well. After that, we're going to lower the patient's bath blanket to its umbilicus area and expose and cover the patient's chest. And we're going to clean the patient's chest next. So, after cleaning the patient's chest, washing, rinsing, as well as drying the patient's chest, we're going to move on the patient's abdomen. So we're going to put the bath blanket on the patient's perineal area while exposing the abdomen of the patient. Next, we're going to wash the patient's abdomen and rinse and dry it as well. After that, we're going to dry and then bring back the bath blanket on top of the patient as well as the towel. After that, we're going to move on the patient's lower extremities, which is the leg. So, sir, ayan. And also provide the blanket again on the patient's lower extremities. Next, we're going to wash the patient's lower extremities, rinse it as well, and dry them. Next, after drying, we're going to move on the patient's foot. So we're going to wash it and take note of the in between of the toes. We're going to wash that as well, and then dry it. After drying, we're going to move on the other part. So let me just this. And expose this other feet of the patient or foot of the patient, and then wash, rinse, and dry. Next, wash, rinse, and dry. After that, we're going to cover the patient back up again and take the towel. After that, we're going to flip the patient on the other side and assist them as well. Let me just see if you please turn around. So here we're going to expose the patient's back and anus. Then we're going to change the water, assuming that we've already changed the water in the basin. We're going to wash our cloth and wash the patient's back. Before washing the patient's back, we're going to place a towel underneath here so that the bed won't get wet. So, and after that, going to dry the patient. And then, sir, could you please go back to comfortable position? Thank you. After, we're going to raise the side weight up again and change the water on the basin. After changing the water again on the basin, we're going to give the patient a perineal care. So first, before giving the perineal care, sir, could you please raise your feet up? Okay, we're going to put the towel in between so that the bed won't get wet, and then give the patient a towel. Sir, are you able to give yourself a perineal care?
Yes.
Yeah. So we're going to encourage the patient to do a self-perineal care to avoid embarrassment for the patient, or to let an embarrassment or awkward feeling of the patient. After that, we're going to remove the towel and bring the patient position to comfortable position. Next, after removing the towel, we're going to give the patient a clean gown. So, sir, let me just assist you on giving a clean pair of gown. So, now that we've given the patient a clean pair of gown, we're going to put a blanket on top of the patient's pillow and proceed with the shampooing part. So, sir, could you please raise your head? Okay, now we're going to shampoo the patient's head. Assuming that we've already done the shampooing of the patient, we're going to dry it. After drying it, sir, could you please raise your head up? We're going to ask the patient if they feel comfortable. So, sir, do you feel comfortable in your position?
Yes.
Okay, and I'm just going to assist the patient a little bit more, and then remove the other cloth and give the patient a new top linen. And remove the band. So, I'm just going to remove this. So, sir, again, are you feeling comfortable in
Yes.
this position? Okay. So, the patient is in comfortable position. We're going to dispose all of the soiled linen. And then, I'm going to proceed with hand hygiene to prevent the spread of microorganisms, and that's all.